Roxanne Wilder with you in South Lakeland, right off of Polk Parkway, and we are at a construction site. Watson Clinic Surgery Center South is under construction, moving along, and I'm so happy to be joined today by Dr. Pranay Patel. And
thank you.
Great to see you. And doctor, so we spoke last time. You, of course, are a board certified ENT, and you're also the medical director for this new surgical center. You're a man who does multiple things, and I was going to say many hats, and here we are in our construction hats today. How you doing?
Good. How are you?
Good, good. So let's talk about the benefits that this will bring this area, particularly the benefits that a surgical center offers an individual versus getting a procedure done in a hospital.
Certainly. We're excited to open the Surgery Center South for Watson Clinic in a few short months, in July of this year, actually. The many advantages of a surgical center are just for the patient experience, just ease. You know, it's easy to come in and out of. The turnaround time is much shorter. Generally, the place is quieter. There's less navigation. The parking is easier. Functionally, certainly surgical infection rates are lower because you're not exposed to as many complex situations in patients as you would be in a hospital setting. And it's from an economic standpoint, it's certainly cheaper on this day of copay and insurance and deductibles. Surgery centers tend to be at least 50% less than the equivalent cases at the hospital setting.
Oh, that's something that everyone is looking for nowadays, those savings in their medical costs. And great point about, I wasn't aware of that, but it makes perfect sense that your risk of infection is less at a surgical center. I want to talk about, too, Doctor, the area that this will serve, both north, it's very convenient, both North and South Lakeland.
Yeah, so South Lakeland has been a growing area. In fact, all of Polk County and Lakeland has been vastly growing. So to accommodate for those needs and to accommodate for these population centers, creating a second surgery center on the south side of town will be, in our estimation, quite helpful to the population. We're bringing a variety of services, you know, from ENT to podiatry, hand surgery, orthopedics, general surgery, urology, plastic surgery. So a gamut of cases and closer, you know, just closer proximity to a growing population center.
That makes sense. Let's talk too about the progress with this surgery center, because here we stand, and of course we've got the appropriate gear on to protect ourselves, but it's moving along. What are we seeing as far as an end date? And I know that's sometimes hard to predict.
Sure. As I alluded to earlier, I think July is our anticipated open time. There's going to be 6 OR rooms. We have 4 at our other place, so we'll have 10 ambulatory surgical center rooms available in the community. This is a nice campus, as you saw when you came in. It's got our medical office building, it's got the hospital all within, you know, a short walk of each other. So it really allows for great delivery of care and access.
And that may be the answer to my next question for you, but as medical director, when you look at this project and your anticipation of it being done and what you as a physician and all your team are able to do here, what are you most excited about that this will bring?
Well, I think we're excited about having new space, larger operating rooms for us to be able to deliver the larger outpatient cases in an outpatient setting. I think that's very exciting. It's going to have state-of-the-art equipment and technology, which is also extremely exciting for surgeons who will always like the newest and best tools and tricks. Being co-located with the hospital and our office building, I think, is kind of ideal for those of the specialists that are located in this new building, because it's going to allow us to kind of roam around without having to do a lot of travel. And also similarly for our patients to be able to kind of move from one space to the other if need be.
That makes sense. If you want to find out more, you can look at the information on the screen and see the web address. And of course, you can visit in person once it's open. And Dr. Patel, always a pleasure catching up with you and talking with you. Thank you.
Appreciate it.